Good evening, everybody. Hi, everyone. Hi, everyone. Welcome to our another Insta Live session. I am Richa Sehra. I welcome all of you on the behalf of Mama Story. Today we have another interesting topic which we're going to discuss with a very special guest who is Dr. Swati Maan, and she's going to share a lot of secrets about being healthy. So just a second, guys. Akash Singh sent a request to be in the live video. Okay. Yeah. So everyone, today the important information which is related to health, which I think everybody would have a lot of questions about it. They'll be answered here in this platform, and we will have Dr. Swati Maan shortly with us, and she will discuss about all these things in details. I'm sure everybody would have noted down their questions. So guys, just keep your questions ready. You can just send us in the chat box, and we'll take up all these questions now. This session will be for about half an hour. So I would want everyone to be a part of it, and do not lose out on any of the question, since every question and answer will be very important for all of you to understand. So I'll just add on. I'm just trying to add Dr. Swati, and I hope she will be with us in a while. And also I would like to wish everybody happy Eid Mubarak to everyone, and I hope this occasion will be so good with for everyone, and everybody will be healthy and safe in this pandemic situation. So let's wait for her for another minute. If you have any questions, guys, just keep writing to all of us, and we will pick your questions now. This session is very important for discussing about health related issues, our daily life issues, and all these details will be discussed by Dr. Swati Maan. She is going to be the guest of today. She's a family doctor. You can also get in touch with her separately. She's a part of W. Pratiksha Hospital, and she's a quite senior doctor in Delhi NCR. She's quite popular in terms of her counseling. She's been very helpful for a lot of families. Hi Raghav, hi Vantika. Guys, keep sending me your questions. Hi Sachin. Hi Gaurav. Hi Mohit. Guys, we need to wait for Dr. Swati to join us. By the time, you can just keep sending your questions. I'm waiting here. There were a lot of people who were actually trying to write me that these questions or problems which you have been facing. So I would want everyone to just write me those questions now. I'm getting a lot of requests for a video view from a lot of other people. So I've got first question from Gaurav. What should we should when 2 month baby spot out milk? Gaurav, can you just clarify your question once again? It's not clearly, I can't understand it clearly, please. Can you just reframe it? Mama Story team, can you just help me joining Dr. Surti? I'm really waiting for her. Yes, I think she's with me. So here we go, guys. The wait is over and Dr. Surti is with us. Hi,
Yes.
Dr. Surti.
Hi.
How are you
How are
doing?
you? Good.
I'm good. So hi everyone. Once again, I welcome all of you to our channel Mama Story. And today we have a very special guest, Dr. Swati Maan. She's an internal medicine specialist and diabetologist. She's going to help us on these topics which are related to our daily life, daily health issues, which are none other than, hypertension, depression, diabetes, thyroid, and all of these issues will be sorted. Your questions will be answered. So keep sending your questions. And here we go. So I welcome Dr. Swati. It's
Hi.
a pleasure to be with you on this platform. I hope this
Thank you.
session goes well and it will be,
Yeah.
valuable for all the audience. So here we
Yeah.
go. So, Dr. Swati, I've been getting
Yes.
some questions from the people. Let's start from there only, since these guys
Yes.
have been waiting.
Yeah.
So I'll just
Hi,
take up one
Shiki.
by one.
Yes.
Yeah. So, Dr. Swati, my first question to you is, uh, I'm going to take up the question from Akash Singh. Yeah. So the first question, I'm going to take it from Akash Singh. He's saying, I have
Yeah.
high
Hi,
sugar.
Akash.
Yeah, I have high sugar and varicose veins, need help in lifestyle change. So can we just say something about it, Dr. Surti?
Yeah. So varicose and high sugar issues are actually two separate issues. Okay. So whether you have diabetes, what type of diabetes do you have, what your sugar levels are, we need to know the entire profile. So can you just specify the question?
So Akash, I want you to specify the question and then you can also get in touch with her separately in case there is something else you want to talk, specific, you want to talk to her. You can directly get in touch with her as well. Another question from Gaurav is, my question was, my 2-month baby spits out milk after feeding. This is not regular, but it happens 2-3 times in a day or so. So he just wanted to,
So I think he should be talking to a pediatrician. I will not be able to help in cases of small. So you have any diabetes related questions, any thyroid related questions, hypertension related questions? Those are the type of questions I'll be able to answer. For a very small kid, it'd be better that you speak to a pediatrician.
Akash just mentioned that diabetes type 2, 200 sugar.
So we need to know your lifestyle, your eating habits, your sleeping habits, your exercise, what medications do you take, does somebody in the family has diabetes, and this 200 sugar is without medicine or with. So that is how we need to work on it.
Sure. So I'll just start with my questions. I'll take the questions as soon as we get questions from people who are sitting online. My first question to start with, Dr. Smriti, is now the new normal is the reality. That how to ensure the health of elders in the family.
Yeah, to ensure the health of the elders in the family, I think that's one very important thing, because we know that the elders are susceptible to more diseases. So we need to, first of all, get their health checkups. We need to take them to the doctors. We need to get the blood investigations, and we need to be, emotionally supportive also. So most of the times I've seen that elderly people in the family somehow feel just left out. So that kind of emotional support, that is also needed. We need to know their BP levels, their sugars. So all of these things need to be tested.
Sure.
There are
So,
certain vaccinations for asthma patients, for COPD patients, for our old patients. So we need to see whether they have taken those vaccinations. There's swine flu vaccinations, there are pneumococcal vaccinations, there are herpes vaccinations, and there are hepatitis. So we need to see if they've taken those.
Sure. I have another question from Preeti Gangwani. She's asking, I am a borderline case of diabetes, and Hybec is in the order. I want to avoid the medication. Maybe you can just read out that question, Dr. Surti. It's a little technical, I think.
What
Preeti
lifestyle
Gangwani
changes?
said,
What lifestyle changes? Hi, Preeti. So I know you. Borderline case of diabetes, HbA1c is on the border. I want to avoid medication. All right. So if you want to avoid medications, then lifestyle modifications is something that you need to do. You need to be very careful about the food that you have, and you need to have regular physical activity.
Another question from Manish. So, hi Manish. So, during COVID-19, how can we protect our child?
See, the precautions to protect ourselves from COVID-19, it is, for the children and for elderly and for ourselves, the precautions remain the same. So social distancing, mask, washing your face, not touching your hands. I know with children it is slightly difficult, but then that is what it is.
Sure. So, then Gaurav Sharma is in. She's asking, I am pre-diabetes. I have pre-diabetes and have 87 kg of weight. I found it very difficult to reduce my weight. Keeping.
So obviously, if so a stringent dietary program is needed for who has asked this question?
Gaurav.
Okay.
Gaurav
So
Sharma.
Gaurav, there is no short method. There's no magic, that has to happen. Some dietary precautions and a stringent dietary pattern is what you need to follow. Like normally we would like to have 60 to 70% carbohydrates, but since for you weight is an issue, we could reduce the carbohydrates and increase the proteins. And also in terms of exercise, at least 30 to 45 minutes of moderately severe exercise.
Gaurav is also asking, my mother feet bone is getting curved from upper foot area. What he can do about it?
My mother's
feet bone is getting curved from upper
So
foot
this is
area.
something which we need to physically examine, whether it's just a calcium deficiency or a vitamin D deficiency, or it is osteoporosis, or it is some age-related issue that she has, or she has some specific infection. So this is something that we need to see.
Cool. So we have a lot of questions. In fact, I'm very happy to see these questions.
Yeah, I'm also.
So another question is from Sapna. Why I feel weak after having food? I feel like sugar levels are going low, though test shows HbA1c level on borderline.
Yeah, so Sapna, you need to see what your fasting blood sugar and 2 hours after what your blood sugars actually look like. So if they're low blood sugar or if you have high blood sugar, then that feeling of, just feeling a little dizzy, that can happen. So we need to know exactly how your sugars are behaving. And corrective measures for this is that instead of having 2 or 3 heavy portions, you divide your meal into 5 to 6 small portions. So that will help.
Another question
and
from
reduce your carbohydrates.
Sure.
जो रोटी का intake है, जो मैदा का intake है, rice का intake है, just reduce it. Increase your vegetables.
Nice. So we have another question, doctor. That's from Gary.
Gary Texan. Hi.
Yeah.
Hi.
This summer the throat is getting affected every now and